Hello everyone, it's Miss Care, and at the time of shooting this training, we are in the Valentine season. So happy Valentine to all the girlfriends in CareStart, and happy Valentine um, for the lovers. I think it's an appropriate timing for the elderly care and special needs support training because this takes the most ultimate level of patience and care that can only be love. So I applaud you for sticking around and staying throughout the KIDE CareStart training program. This is the final day, although there's a caveat. There's always more with Miss Care. So after today, we would have the final exam, and then after the final exam, those who pass in terms of attendance and passing the exam will now move on to the more in-depth private specialist training that will prepare you for work specifically and prepare you for placements with CareStart. So stay tuned. It's getting more intriguing as we go along. As I said, this course is for aspiring nannies, housekeepers, and domestic caregivers in Miss Care. Let's go ahead. Today we'll look at caring for family members, elderly family members safely, right? And how we can support their mobility and their hygiene, how to communicate respectfully with them and recognize their emotional and health needs and provide that assistance daily. Also, organizing or helping the family through organizing their living spaces is part of the duties of a domestic caregiver. So here, we've highlighted here the fact that caring for elderly requires patience, respect, and compassion. Patience, respect, and compassion. If you ask me, the order should be compassion, which leads then to respect, and then incites in you the patience, because everything we do stems from love, and compassion is a part of love. This compassion is what will allow you to put yourself in their shoes, although you may not be that old or that much in need of support. And it's that same compassion that will allow you to respect what they say and have the patience to take care of them throughout your stay with the family. So hopefully at the end of the course today, we'll be able to know what to do in various circumstances so as to give the best care to the elderly. Okay, so before we even step into it, we need to understand certain basic traits about the elderly. Again, just like we discussed with the babies, there are certain ages and what we expect people to do. When it comes to babies, because they are fresh into the world, apart from a few outliers, most will follow a particular trend. But for the elderly, it can be completely different because each person has had a long time to design their body. And by design their body, what I mean is we each have different ways that we have exercised, we have eaten, we have communed with others throughout our lives. So elderly care is more specialist and is something that is really individual based. You could have 7 years experience with elderly care, 1 year with 3 different clients, and then still learn new things, still have to be open-minded with each new client you have. So elderly care is really specific, apart from the generic things that you have to know about older people in general. It's very important to keep in mind that you are dealing with an individual, you are dealing with an adult who can think for themselves and they understand what they need and what they want. So typically, we will say that elderly people move slowly, typically, but you could be placed with someone who is faster than you, depending on their health status. Typically, as the body grows, we expect that certain parts are becoming weaker. So the eyesight is one of those things that become affected as well. So typically you would expect that they have weak eyesight or they have some aid in terms of glasses to help them to see. You need to bear all that in mind. When it comes to the memory, it's more likely that an older person may forget a few things here and there because of the weakening of their memory or not. So don't assume any of these things. Be aware that they could happen, but take the time to make the observations for yourself and listen to the family that have indeed contacted us to provide this care. And before you be sent to provide care, of course, there will be some care needed. Nobody likes to throw money away. So this person would require your assistance daily. So bear this in mind. You are working with an individual and an adult who can make decisions for themselves, who has more wisdom, observation of life and all of that, but they need your assistance. So they are in a place of independence but need your assistance. That's the difference between being a nanny and being a caregiver. The child, especially when you're dealing with infants and the babies, even some of the toddlers, they are not independent. They need you fully. But with the elders, they are independent in some aspects and need you for other aspects. So you need to be understanding of the needs of the particular patient that you have. If you look at the pictures that we have attached here, one client needs to be pushed around in the wheelchair, so she has mobility issues. Another client has mobility issues, but at least she can stand on her own 2 feet. So this to show you the differences in care that may be needed by each individual. So when we say the needs of an elderly person, because of the explanation that I've given in the previous slide about each individual's, the state of their body being different depending on how they have used their body or depending on why they even need assistance in the first place, whether they had fall or they had an injury or something, those physical needs are different. But here, what we want to highlight is that for all elderly people, and for all elderly people whose families have requested our service, then these 4 things are universal that we have to keep in mind. That they need your respect, they need your assistance. This is where it's nuanced, right? Assistance can mean different things. help fetch water for them to bath, help bath them, or help them dress up after bathing. Different assistance, but they need your assistance. So be willing and open to give that assistance. But the respect is universal. Whether they are walking on their own, or they are bedridden, or they are moving a few minutes a day, they need your respect. They need your assistance. They need some companionship. It's not always the case, but often the older people are left behind at home when the work-going age people have to go to work, or kids are in school. So their original families may not be around, or you are there in the window that their original families are not there. In some situations, they are living alone. They still love their old house. They want that independence. So you are sent in to go give that assistance. So the companionship part of it is crucial. You cannot go about it like a live-out housekeeper who has just been sent over, clean, and then leave. Or generally, what someone could provide assistance generally and be in the shadows, not be seen. When it comes to full family life, you could have an assistant who is helping you do things, other tasks, but it's not really integrated into the family. It's not necessary as a nanny to have a 1 hour long conversation with the parents, but it's necessary to engage with the child. So in this case, the elder in the home is the one who needs your companionship as an elderly caregiver. So it's important that you are not only hiding behind tasks of cleaning the house, washing her plate, getting her food, giving her her medicine, but that you go the extra mile to converse, have a talk. And you see what this caregiver is doing here in this case. The madam is looking on her laptop or her tablet, and then she's chatting with her, and the client has a smile on her face. So whatever the chat is about is going well. You need very early on, when you get there, to create that rapport. Here also there's a caveat. There are some people who really do not want people in their face. So you need to gauge that and see what companionship means for this person. If you found that grandma or grandpa has a routine where they take their evening tea, once or twice they ask you to do it. The third time, you just provide it on time, around the time that they need it, without them asking. And then they feel like, oh, this person is going the extra mile. And after you've provided it, you could have a seat and ask, oh, how do you find it? Make time to strike conversation and provide that companionship. So, unlike with the babies where safety was first, because of course they are helpless human beings and there's nothing you could do for them, they could do for themselves, Here, safety is also key, but is the last mentioned here. Again, back to the fact that they are adults, they have their routine, they know some of these things. You are just there to aid their independence. And so you need to make sure that you are giving them the room to be independent, whilst you are making sure that they do not hurt themselves in the process. So if it's about preparing tea, and grandma used to do that, put the kettle on herself, if you realize that her hands are a bit shaky, then please let her stay away from the hot water. So keep that in mind, that they need to be kept safe, they need companionship, they need assistance from you, running errands, doing some chores, and ultimately they need your respect. We here want to highlight some common health challenges. Don't assume all for everyone. For each family, they would probably tell us in the brief before you are assigned there in the conversation with the elderly person or with their guardian or their child who has asked for us to render the service. What they would want us to know, what is affecting their health, will be revealed to you. Again, confidentiality. But some common conditions would be arthritis, poor vision, hearing problems, sometimes high blood pressure, diabetes. These are common things that affect the human body as we get older. This does not mean that every older person you see has all of these things. They may have some of these things. So you be mindful of that and then act accordingly in a way that you can help them. If they are on medication, remember to give it to them on time. If they have difficulty getting up and there's some soothing thing that you can do for their knees, with their arthritis, you help them out. If they have poor vision, you be aware of the lighting in their room, open the curtains to help them about. So this is just to give you an idea of common health challenges. I would say though that for most of the caregivers in care, they are fully trained nurses, nursing assistants, or people who have had very long years of experience. We do not usually give the caregiver jobs to untrained hands because it's more specialists. So those of you who are preparing to be caregivers probably know all this better than myself. Okay, so assisting with movement. This tends to be one of the most common things that we are expected to do as caregivers. And it's something that could be done multiple times a day. So it's very important that we pay attention to how it is done. And it's very important that we do it safely so that we don't rather aggravate whatever the situation is. So the person should stand slowly, assist them to stand slowly, walk carefully, and use support. But the way this is done, and here when I was learning about these things, I recognized that we haven't been doing it properly with even my own dad. So you have to stand beside them and not pull them forward like you're standing in front of them and pulling them towards you, because then everybody is at risk. You could fall and bring them tumbling down along with yourself. You need to stand beside them and aid them up. And once they are up, give them some time to stabilize and be ready to move their feet and move slowly at first until you can increase the pace. This is very important that you move slowly. When you move slowly, just like in a car when you're driving, you are in control of what happens after. If anything is an obstacle, you have enough time to react and prevent a certain level of escalation. Same way, if you are walking with an elderly person and you're moving slowly at a pace that is comfortable for them, it allows them to avoid certain things like trips. Honestly, falling down is one of the highest risks for older people. Their bodies do not heal as fast as for younger people. So it's important that besides the old age, we do not add injury on top of it. So be very mindful of that. The person under your care shouldn't be worse off under your care. So yes, falling is one of the main risks. So be aware as the caregiver, and also provide that same awareness to the other members of the household, or even your primary care person, the elderly person you are caring for, because they may not have thought about it that way. But the way a home is designed when she was younger may not be appropriate for an older person. You may need to rearrange, move some things around so that they do not trip, they do not fall. This is especially important if it's a combined housing setup, like the elderly person is in the midst of their family, which has the full range, kids, adults, teenagers, then everything could be anywhere, in the hallway, in the hall, and whatever. And when the rest of the home doesn't feel safe, they tend to stay indoors. They wouldn't come out and socialize. But it shouldn't be that way. It shouldn't be that they are stuck in the room if they can move out. So have this in mind, that there's an elderly person. We need to prevent a fall actively. You keep the floors dry. You remove any obstacles. Before you have a plan to take them out for a walk, you do a walk around the path and make sure that everything is good. Provide the support, be beside them, let them feel that you are there to catch them if they fall, but they wouldn't fall because you are already providing the support. And if they need walking aid and all of that, they will probably have that by the time you assume. This thing, point number 4, if there's anything you take away from this training, it is this: always ask before assisting. Always ask before assisting. And here I'm highlighting this because the main difference between the primary care that we usually do, that's a caring for kids, and caring for an adult, is that an adult has lived a majority part of their lives independent. They are dealing with the fact that they have low mobility or whatever their pains their bodies are taking them through. One thing which is very important to them is respect. And every person has a certain circumference around them that is their personal space. And if a stranger comes within that, you would feel uncomfortable, even if it's a family member and you haven't invited them in. There needs to be some consent before someone gets that close to you. So even though you are the caregiver, always have that in mind, that there's a consenting adult, there's an independent adult. I'm here to help, but always go that extra mile to be courteous and ask them, tell them what you are going to do before you approach. Don't be in their space. Just because, I'm bringing your medicine. Then you are standing right in front of them. It's like, oh, yes, doctor, say, me for 6. Always have it in mind that do not enter their personal space. Do not assist with anything before asking. You've seen that her phone is on the side. Oh, Grandma, can I pick your phone for you? Okay. Grandma, can I give you a cup of tea? Okay. Ask for permission. You are assisting, but have it in mind that you ask for their permission. This boosts their confidence that they are still independent, they are still making those decisions themselves. Of course, if someone is about to fall and you need to catch them, that's not the time to go and ask Grandma, can I catch you when you fall? I hope that is obvious enough. Okay, so hygiene, bathing, and assistance. Most elderly caregivers are there to help our clients to bathe safely, and bathing is one of the high risk portions for a fall, whether it's us getting into the shower while showering or coming out. Some homes already have those fittings put in place where they can sit comfortably. There's anti-slip mats that they can stand on, you know. Some homes have that already. If they don't, it would be good to suggest it so that we prevent a fall. Prevent a fall. In terms of keeping up their hygiene, most older people, I'm using grammar too much. Most older people have their routine already. So if it's her routine that she baths 2 times a day, you are there to assist her to do that. It's not up to you to go change the routine. Grandma, join your bread and one. Help her to go ahead with her routine in a safe manner. Help with the dressing. Again, consent. This is the time when they are most vulnerable. They are most they're showing themselves to you, and depending on how long it has been that they are doing this, it may be a bit uncomfortable. So here you show that you are mature, you are a professional. Ask to come in and help and respect the space. There's a Bible story about some kids who saw their father naked and wouldn't even want to see. They covered up his nakedness. Let that keep you mindful of the fact that someone may be helpless now and need your assistance, but there's a way you will assist someone and they know that this stays between us here. So you need to have maturity, you need to have discernment, you need to do this in a respectful manner as much as possible. Their grooming, this is something that I'll have to highlight a lot because so many caregivers forget this one. After the bathing, the regular things, especially if it's a client who is not asking for assistance with dressing, you realize that the grooming part can be neglected. So they'll go for days, the earwax will be removed, they'll go for days, and you see certain parts of their bodies are not oiled or moisturized properly. Fingernails will be too long, or you need to keep an eye on that because all that is under your care now. Then here in bold is maintain privacy and dignity. Privacy and dignity, they are all ways of respect. And that is what they need. Always. Okay, so let's go ahead. Medication supports. Medication supports. A caregiver must remind the family about, or the person under their care about medication time. This means that there will be a timetable for the medication that you would be told about by the family. After that orientation, now you are the main person supposed to remind either the family or the client directly the elderly person you are caring for that it's time for their medication. And not just say it's time, but as you can see this male caregiver doing here, he's provided it along with some water. You make it possible for them to have it. It's not enough to say, oh, it's time for para. You bring the thing to them, make it easier for them. If you know it's supposed to be after meals, it means that your prepping for meals should be before the time. And it's important that you stick to the time, because most medications, time is important. Also, the onus lies on you to be observant of the reactions. If there's anybody that is close enough to the elderly at this point, it's you. So if it makes her feel dizzy, if you make an observation, take note of it and discuss with the primary guardian. Report these concerns if they come up. Don't assume that, oh, they know she's been taking this medicine, so maybe that's all. It's some of these observations that help in their next doctor's visit for some things to be reviewed or changed. But you yourself, after making the observations and raising those concerns, do not have the power to change a dosage. So, respect, companionship, assistance, all that is on the borderline of emotional care. What you are doing there, along with the physical things of providing food and all of that, the biggest part of it is really emotional. It's really connecting with the person. Some elderly may not feel this way, but some do feel lonely, depressed, and forgotten. So they feel like, everyone has abandoned them now. So it's your job to help so that they don't feel lonely, they don't feel depressed, they have someone to talk to, someone who shows the genuine love and care. And don't leave them out for too long. You could be in the same home and you abandon them for too long such that they feel like they are forgotten, they are not useful anymore. Please engage with them. So, some elderly people may be speaking slowly. Okay, this is wrong. It's not me feel. So this is what we are telling you to observe. For your communication tips, you should speak slowly to them. Speak in a way that they would understand, right? Speak in a respectful way that they understand that, oh, okay, grandma, we need to do this. Not sorry, but say me uncle. Sorry, but say me uncle say. Use a respectful tone. And for some caregivers, the reports that we get is not just that you didn't do the thing, it's your mannerism, the way you would say, okay, I've heard you. Remember, these people are from a different generation, not the typical disrespect that we are allowing on social media and new generations and accepting and imbibing cultures from different places. For the majority Ghanaian families that we serve, and generally people from not just Ghana, but people from every part of the world from that generation, they value respect, they value it's better to assume that they are conventionally minded, and you won't go wrong with that. Even if they are not, they would appreciate the extra mile to go to show that respect. So you need to listen to them, whatever they're saying, listen patiently. Don't be seen arguing or exchanging words. And all these things, they support health. You may not notice it, but when someone is emotionally supported, when someone is grounded, when someone feels loved, they get well better. Yeah. So avoid shouting, arguing, grandma, grandma. That's why we use nurses really for this placement, because by their extensive training, they understand more. But most importantly, besides your degree or whatever, it's someone who understands that this person needs respect. So, and this person could be someone who has forgotten something. So it's likely that they are saying something to you that, as far as your memory goes, may be false. But do not argue. They are your clients. They are your clients. So do not argue with them. Okay, so let's look at some of the basics of some. When we say special here, it's not like autism spectrum special needs. It's more like extra things that you may need the caregiver for. Some people may need help to move. They are completely bedridden. You need to turn them around, avoid bed sores, and even to get out of bed, go to the shower, do anything, they will need your support. Some people may also need feeding assistance, and you can't only just prepare the food and place it before them. You have to actually help feed them. And some people may have special needs in terms of communication. So they may not be as audible, or they may not be as understanding because of what we mentioned earlier, that elderly people sometimes have weak memory. It's important that you are patient and you are observing and you are taking the advice and guidance from the family. Every condition is different, but with enough patience, you can help them effectively. Now we'll look at the safety, the final part that we discussed, safety in the home. So a little bit of safety consciousness here and there will prevent injuries. So keep walkways clear, ensure there's good lighting. The place may look very bright to you, but not to the elderly person. Make sure there's good lighting and they can see where they are going. And also keep emergency contacts ready. Know who is the primary emergency contact for the person you are taking care of. Now let's look at some quick facts. When it comes to falls, it can really lead to injuries. And this is not just in Ghana. This is a worldwide phenomenon. So for older people, always keep in mind that you are trying to prevent them from falling. Also, when it comes to the emotions, the loneliness that they feel if you do not provide that companionship actually increases their risk of illnesses. So the emotional part is just as important, if not more, than the physical help you're providing. When there's proper assistance from you, it reduces the need for them to keep going back to the doctor. So here is proper assistance. It reduces the need for these hospital visits due to injuries. And ultimately, respect respect, when they see that you have respect for them, it improves their cooperation with you, which makes life easy. Compared to the others, it seems like for the caregivers, I'm being a bit particular, repeating myself a lot because it's important. We cannot stress it enough. Elders are elders. It's important that we respect them, but more especially an elder who may be ill or need assistance is already dealing emotionally with that. It's like me and pa mini, you get it. So they are dealing with a lot. You are there to help, not to be part of the lot they are dealing with. So do not rush them. You typically would know that at this walk that we are going for, sometimes I go for don't tell him, but sometimes I go for walks with my dad and I feel like I'm more tired. An exercise that's supposed to energize me, I'm more tired because he's walking more slowly. But it's not in my place to rush him. That is his pace now, right? So do not rush them. And do not ignore their complaints. You see, the person may be telling you, I don't like tea, I don't like tea. And you want to insist that, Mom, it's been tea that we've been drinking all this while. Don't ignore it. She knows what she's feeling, or he knows what he's feeling. So don't ignore the complaints they are making. Don't say they're complaining too much. Don't be too complacent with their complaints. Don't lump it all as nagging. Listen, observe, pass it on to the relevant people, like their families, so that they can take action. As for this, it's a horrible no. Horrible. No. Pulling shouldn't happen. Don't pull them forcefully. Again, their joints could dislocate. So be gentle, support from the side, and help them up. And then leaving them alone for too long. It's typical that most elderly caregivers have other errands to run, which are all part of the support that you are giving to them. But remember that the primary work is that person and all their personal needs. So do not leave them alone. Do not be busy with so many other things and leave their person alone. Mary versus Martha, Jesus situation. So stay with the person. The majority of the day, when you're done with your task, you can put your tasks, schedule them around their nap time and things like that, so that at every point in time they are in your eye or ear shot. So it's been a long couple of days, but we are here at the end. Our key takeaway for today is that a caregiver needs patience. A caregiver has to give kindness, be attentive, and it's all these things are just as important as the practical skills of feeding, cleaning, and all of that you are giving to the vulnerable household members. Announcement. We'll do our final exams, and then those who successfully pass will move on to that career readiness session that we mentioned earlier on. It's been amazing giving you this training, and I hope that you've learned something, at least one thing or another, from the practical examples that we've given and from the tidbits that we've been sharing. Feel free to add your own also in the comments or during the evening sessions. Take care.